Hello, students, and welcome to Gulf Coast South Area Health Education Center's Career Chats. Career Chats is just one of the many student programs that we offer at Gulf Coast South AHEC, meant to help you explore all the different opportunities that are available to you in the healthcare field. You might recall that there are over 300 health career options that are available to you. So you need to do some exploring, and the sooner the better. With Career Chats, we bring interviews with healthcare professionals to you, several of them each and every year. And it is my honor today to present to you Amy Miller. Amy Miller has a master's degree in nursing, and she is working as an advanced oncology certified nurse practitioner, specializing in lung cancer screening, early detection, and prevention at Sarasota Memorial Hospital. Amy also facilitates quick classes as a certified tobacco treatment specialist for Gulf Coast South AHEC. Go ahead and say hello to the students, Amy.
Hi, everybody.
To start with today, I'm going to launch a video. It's about a 4-minute video on the role of the nurse practitioner in cancer care. So bear with me just 1 minute as I share this screen. And Amy, I'm going to look to you that when I start it, that I need you to give me the thumbs up to let me know that the sound is working appropriately. And here goes.
I work as a nurse practitioner with a large multidisciplinary team. The team consists of the attending physician, a registered nurse, clinical assistant. There's also social services, as well as other domains of the oncology team, such as the radiation oncologist, the surgical oncologist, the infusion room nurses, chaplains. So there's a very large, wide range of people that we work with. On a daily basis, my job mainly consists of the symptom management and the side effects that patients are suffering, or from treatment-related side effects or disease-related side effects. I work very closely with the physicians in treatment planning and decision-making regarding any changes to the treatments that we need to be made, whether they have like disease progression and we need to come up with a new treatment plan, or perhaps if there's any dose reductions or different decisions that need to be made regarding making their care the best that it can be without compromising their quality of life. I think that's the main goal. We're not here to, try and make them, our goal is not to make them feel ill, or our goal is to try and give them the best quality of life that they can for as long as they can, while they're on treatment. So I work very closely with the patients and their families. I find that a large part of my job is just also making sure that they are feel educated, and that they feel that they know what to do in a situation when they are suffering from side effects from treatment or their disease, that they know who to call, especially if it's an emergency situation, or they know how to manage side effects at home that maybe aren't as more emergent. Being there as the nurse practitioner to help guide them and provide them with as much education and information I can, so that they feel that they can deal with this and know how to manage their symptoms and side effects, is the biggest part of my job. We definitely come up with treatment planning decisions together. Once a week we have a tumor board that encompasses the surgical team, the radiation oncologist, the medical oncologist, the gastroenterologist, the radiology team, nurses, the nurse navigators. This meeting occurs once a week, and we identify cases that we feel are important to share with the group, and or if we need assistance in decision making, or we feel that it's time for a switch in the treatment planning from maybe more systemic options, which is more medical oncology focused, to more localized treatment. And we can present cases at the tumor board so that we can identify if there's any other types of localized treatments, whether it be surgical oncology or radiation oncology, or the interventional team to guide us with more localized treatment options. And also just to review cases together as a group to make sure that everybody agrees with the treatment planning that we have with the patients, that what we're doing, that this is a group decision. We work in a very team-oriented environment, and it's wonderful. It's great to have such easy access to other team members. In the clinic setting, it's ideal because the way the clinics are designed is that, for instance, I work in the medical oncology team, and the next room down is the radiation oncologist, and the next room down from there is the surgical oncologist. So we have easy access to other domains of the multidisciplinary team that we can bounce ideas off of, or look at a scan if we wanted somebody else's opinion regarding maybe a lesion or growth of a disease. So it's pretty ideal, and we're very fortunate to have such easy access to other team members.
All right, Amy, as we saw in that video, cancer care is very much a team effort. Can you please give us an overview of what your part is within that cancer care team?
So for me, I work more in the early detection and prevention aspect of cancer care. So specifically, I work with a lung cancer screening program. And so, we in the cancer world know that the earlier you detect cancers, regardless of the type, the easier it is going to be to treat it. So, for me, that always really rang true, because I think for nurses, we really do look at the, a pound of prevention, or an ounce of prevention is worth a pound of cure, right? So we really want to make sure that we are helping people understand the importance of early detection, screening, along with healthy lifestyles to help prevent these cancers too. So, I really agreed with everything that the nurse practitioner shared in the video. I think one of the things that you can sort of consider with oncology nurse practitioner, with that sort of an education and a degree, is that there are a lot of different avenues that you can continue to work in. So she specifically worked in a medical oncology practice where, they were mainly seeing patients that had maybe some more advanced stage cancers that were being treated with, chemotherapy, immunotherapies, biologics, those sorts of things. And so that's sort of a medical oncology perspective. There's also the radiation oncology perspective, and she mentioned that as well. The surgical oncology, so there are a lot of different things where an oncology nurse practitioner can kind of find her specialty, or find her niche and her place of comfort. And it goes even further to even possibly, survivorship care. So survivorship care is typically, once somebody is done with their cancer treatment and they need somebody to sort of follow them in that post cancer treatment phase of their life. And then also to hospice and palliative care. I mean, that's a big area where an oncology nurse practitioner could easily fit into. So there's a lot of different areas where, kind of along that, continuum of care, from early prevention and early detection all the way through to hospice and palliative care. So, there's a lot of different options. Coming back to myself, I focus on the early detection and prevention of lung cancer. So lung cancer, not many people realize this, but is the #1 cause of cancer death. It takes more lives than breast, colon, and prostate put together. And I think that, many people don't realize that, right? Like, so we know that October is Breast Cancer Awareness Month. I mean, you see pink everywhere, but does anybody really know when National Lung Cancer Awareness Month is, or what the color is that represents it? But, far more people die from lung cancer than they do breast cancer. So one of the things I like to try to point out to people is that actually more women are diagnosed with breast cancer, but they survive. And it's all because of early detection. So mammography, right? So every woman over the age of 40 knows that they need to get a mammogram every year, right? That's kind of standard practice. And that has been for many, many years. And we're going on like 30 years of breast cancer screening. Lung cancer screening is relatively new. It was really only studied, in the 2000s, like 2004 to 2009, they did studies regarding, the early detection of lung cancer. Many studies overwhelmingly found that, a low dose CAT scan annually will help decrease mortality by about 20%, which is a huge number in the screening world. Very simple test, and it's really the thing is that it's geared towards people who are considered high risk. So those people are people who have a smoking history. So I think that because lung cancer is really tied to the stigma of smoking, it hasn't received the attention that it needs. And so part of my job is to really sort of fight against that stigma. A lot of people sort of have this idea that, if you've smoked your entire life, then you knew it was bad for you, hence, you have it coming, basically. And so this is an attitude and a perception that we at Sarasota Memorial are working really hard to combat. We don't believe that anybody deserves to get lung cancer, regardless of what your choices have been in the past. Also too, a lot of people misunderstand the whole idea of nicotine and the addiction, and that sometimes, it goes beyond just making a choice, right? You're physically addicted to this substance, and psychologically as well. So it's a real challenge. So that's why I find a big part of my job being in the tobacco treatment world. Everybody that comes in for a lung cancer screening that is currently smoking will get one-on-one tobacco treatment counseling from me. And we explore really all options for helping them quit. And that's the whole idea of the early detection and the prevention. I do work with a multidisciplinary team as well. I go to tumor board once a week as well. Again, it's early stage, so we present, most times it's early stage. So we present those cases that have some really indeterminate findings. And again, like the nurse practitioner in the video said, we have a team of physicians. We have a thoracic surgeon. We have a thoracic radiologist. We have medical oncologists. We have radiation oncologists. We have a team of people that can really sit there and look through the scans and understand what the findings are and really give the best recommendations for the patients moving forward. So that's sort of how we utilize our tumor board, or we call it actually cancer conference. So that's very, the points that she made were very on point. But there are some, significant variations in the jobs depending on what little niche you decide to go into.
Right. And I thank you for explaining about the different specialties just within oncology care. It's important that the students, when they're trying to make that decision and they think, all right, I'm going to be a health professional. Well, that's great. What's your career? Well, nursing. That's fantastic. Are we talking nursing assistant? Are we talking practical nurse, registered nurse, nurse practitioner, doctor of nursing practice? So it's important that students understand there's many different choices that are available to them. Now, tell me, how did you fall into the screening and the prevention and the early detection? How did you fall into that area?
So, that's a good question. I had become a registered nurse many years ago. Actually, I graduated from nursing school initially in 1992. So I'm coming up on my 30-year anniversary of being a nurse. Sometimes it's hard to believe that I'm saying that, but
I don't believe it.
Yeah, it's a process, right? So, you go to nursing school, you want to become a nurse. And so I became a nurse, at quite a young age. I was like 21 when I got my RN and NCLEX, licensure. And I always knew that I wanted to continue on and go into advanced practice, and I think that you, in the meantime, have a job and you're working, you have a family, you have responsibilities. And so sometimes that, further education gets put off, that's one of my biggest pieces of advice is, you can have a family in your 30s. If you want to go on and get your master's degree or your doctorate in nursing, do it before you have, sort of some of those other responsibilities. It's going to make your life a lot easier, and you'll have it kind of behind you by the time you want to, settle down a little bit more. That's not how I did it. From the time that I graduated with my associate's degree until I got my master's degree was 20 years. And, if I could go back and do it over again, I would absolutely have made probably some different choices and trying to get that master's degree sooner than what I did. But, I'm here now, and I'm glad for it. Getting my master's degree was not easy. None of nursing school is easy. And you have to have more than smarts, or high IQ or anything like that. You have to have determination. You have to have just pure grit to get yourself through it. And if you have that, that's going to count a whole lot more for you than any level of smarts. Um, so I actually went back to, so I actually worked for the local hospice and I still actually do on a per diem basis. And I started working for them in 1998. So it's been quite a few years. And through that process, I had gone back and got my bachelor's degree, and I knew that I wanted to get, into an advanced practice. And so while I was still working for Tidewell Hospice, I went back to graduate school. And I just had gotten my, had gone down the path of oncology, advanced oncology certified nurse practitioner. Um, and in the thought that I was going to be staying with hospice and working more palliative care. And, palliative care is the big part of palliative care is really treating and managing symptoms, so whether it's pain, nausea, vomiting, restlessness, anxiety, those kinds of things, shortness of breath, difficulty breathing, that oncology nurse practitioner certification was really going to help me in that kind of realm. So that's why I chose that. After working for about 3 years as a nurse practitioner with hospice, I kind of felt like I wasn't using a lot of my overall skills and knowledge to the best of my ability. And when I heard that Sarasota Memorial was hiring a nurse practitioner to initiate a lung cancer screening program, I just really felt convicted about it. When you spend so much of your time looking at that side of people's lives, end of life, a lot of people obviously dying from lung cancer or other smoking related diseases, COPD, emphysema, heart disease, you kind of, sometimes you go sort of towards the opposite. And so that's, I think, what really drove me was that I saw so much of what was going on at the end of people's lives, because of, late stage cancer diagnoses. We know that smoking lung cancer isn't the only cancer that smoking is responsible for. There are about 10. And then also to all the heart disease, lung disease, things like that. So I kind of thought, well, wouldn't it be great to be at the other end of that spectrum and really working with those people who are still healthy to help them understand and get them beyond this addiction and move beyond, being a smoker to a non-smoker, and then helping them prevent a lot of this disease down the road. And also to, really the world of early detection for lung cancer is huge, right? It's going to make such an impact on saving lives. And the sooner that we can get lung cancers diagnosed, the fewer people that are going to die from it. So that was a big motivator for me as well. It's just really getting people on board sooner rather than later and getting the care that they need.
Well, I'm glad you shared your path and how it wasn't necessarily a straight line to nurse practitioner. And I can tell you that as many of these interviews as I've done, many health professionals have told me how, their path might have been a wiggly line or a roundabout line, and they came back to it. And everybody will find their own path. And so to reiterate to students the steps, of course, graduating high school. Right. Now, registered nurse, is that 2.5 years plus the exam?
It depends. It totally depends on how you want to go about it. So like I knew when I was in high school that I wanted to be a nurse, and I think that I grew up watching my mother struggle financially. She didn't have a college education, and it was a challenge for me growing up, sort of in an environment where my parent wasn't, able to really secure a job that was going to meet our needs. And so I know a lot of people may criticize me for that, but I knew that if I became a nurse, that I would always be able to work, always, and I would always have a job. And that was one of the big driving motivators for me. I mean, just to be honest about it. I mean, fortunately, I love working with people. I love working with patients. From day one, it was always something that I really, felt very convicted about. So of course you have to have that sort of side of compassion and empathy and wanting to help people as well. I mean, if you don't have that, then it's probably not the best career choice for you. But, I graduated from high school and basically, went right into nursing school. So I was like, literally, I mean, I turned 18 in September. So I was still 17 when I walked through my first door of nursing school, which at that time, looking back, I knew that I wasn't quite ready for it. So I took about a year off and then went back to nursing school and got my associate's degree. So I graduated in May of 1992 with my associate's degree, and that 2-year program. I mean, of course, you have prerequisites and things like this. So it's solid 2 years, but then you have a semester or two before that to kind of get your prerequisites on board. And then you have to get accepted into programs. A lot of programs are highly competitive too. So you always have to do the best that you can to make the best scores on your prerequisite classes. If you're able to work as a CNA or something like that during that time, that's always helpful. That will add points, that will add sort of some points in the staff looking to get you admitted into a program, or any healthcare related field where you have some experience, which I didn't have any. So that going into nursing school was a little bit of a challenge too, because I had no idea, what it was like to work in a hospital or a nursing home or, any of that stuff. So that's, it's not a bad idea to work maybe as a CNA first for a year or two before you actually go into nursing school, because it will actually open up your eyes to a lot of things, and it will really help you say, yeah, this is totally for me, or no, this is not for me at all. So, I think that that's actually a really good path to consider. And I know that there are a lot of CNA programs that you can do that are actually really pretty brief, a few weeks to a few months, depending on how concentrated it is. But I went into nursing school, graduated in 1992 with my associate's degree, was able to sit for the NCLEX RN exam. I'll never forget it because it was at the Tampa Convention Center in like September. So you had to wait several months after graduation to actually take your exam. And we sat in the midst of thousands of other people taking their exam. And then the other thing was that you had to wait several more months to find out that you actually passed it. And it was in the mail, but this was before we had a lot of, the technology that we have today. Nowadays, you go to a testing center and you take it online, or you take it on a computer on a testing center. So it was a lot different then. And then pretty much soon after that, I started taking, a class here and there, working towards my bachelor's degree. And that took several years to do that. And then I had my bachelor's degree for quite a while, worked more middle management for hospice, and then decided, what, I really am ready to go back to school. It's time for me to get my master's degree. It was right before I turned 40. And it was like, okay, now or never kind of a thing. So that's when I decided to do that. And it took me about 3 years to get my graduate degree, 3 years and 3.5 years to get my graduate degree, because I had to work full time, had a family, and it was not easy. The last semester was even more challenging. I had to do when you go to school to get your nurse practitioner, you not only do you have all your your classwork, but you have to do clinical practicum time, and it's about 500 hours. So over the course of 3 semesters, you have to do that, in addition to your classwork, in addition to everything else, your job and stuff like that. And then on top of that, I actually had to spend that year writing a thesis too. So had to, perform research and, write a huge, paper on that, have a thesis committee, things like that. And so that year was probably the hardest that I had. But you know what, you sit there and you think, how am I ever going to get through this? But you do, again, determination and grit, you do. Yeah.
And it's important for students that are listening in to understand, it's obvious that you have dedication, not only to the nursing profession, but also to your patients, or otherwise you wouldn't have gone through all of these steps to get to where you are now. And I'm glad you mentioned CNA, Certified Nursing Assistant, because there are many schools out there that offer dual enrollment to high school students.
Right.
So if they're not aware and they're listening right now, talk to your career counselors, talk to your counselors in high school before your junior year, so you can make sure and get signed up for dual enrollment. For example, if you're in Manatee County, you can attend classes at Manatee Technical College, or if you're in Sarasota, at Suncoast Technical College. If you're in Charlotte County, Charlotte Technical College, you can take dual enrollment classes to go ahead and get your certification as a nursing assistant. And nobody can ever take your education away from you. So no matter which field of nursing you choose to go into, or heck, if you end up going into another health profession, nobody can ever take that CNA away from you, and you can always get a job making good money on the side as a CNA and then use it as a stepping stone.
Yeah. I think that that's the important thing to think of is that a lot of times, a career in nursing is really a journey. It's not, oh, I'm just going to go to nursing school and then, that's it. I think that you really do want to look at it as more of a journey, in your career path in life. And I think that starting as a CNA, is an excellent option because, and I can tell you this, from working at the hospital to working in hospice to wherever I go, the backbone of nursing is often the CNA. And the CNAs are the ones that are work most closely with patients, have oftentimes these very close relationships and are often the ones that will come to the nurses and say, listen, this is what's going on with this patient, or this is what I'm seeing, or, I think that this is, really causing an issue for this patient. So, truly, the nursing assistant profession, is an incredibly admirable way to go about it, to start. And if you love it and want to continue in that the rest of your career, fantastic. A lot of times it is a stepping stone, but it really does teach you how to take care of a patient, how to feed somebody safely, how to do mouth care, how to give a bed bath to somebody. You think, oh, how do you give a bath to somebody who's can't get out of bed? Well, there's a way, and they teach you that, and nursing assistants do it all the time. They're just really the backbone of nursing, and I can't ever say enough for any of the CNAs that I've ever worked with. They've all been amazing, and I wish that I had started my career that way as well.
I understand and agreed. I think it's a great way to dip your toe in and see if you do indeed like the nursing profession. Now, what a lot of students are concerned with, those of us who don't have money trees in the backyard, how do you pay for your schooling?
Yeah, that's a really great question. It's hard, right? Because I have adult children that, have, some student loans. I have adult children that I'm helping pay for tuition because I don't want to see them go into debt, you know what I mean? But I think that, if you don't have that option, don't let that be a barrier to you going back to school. Is it cheap? No, it's not. You know what I mean? Are there ways that you can figure out how to do it to get things paid for? Where there's a will, there's a way. I was fortunate. I did not have to take any student loans out for my graduate program, but I have many friends that have thousands of dollars of debt because of their graduate education. And, it's one of those things where they'll be making payments for, quite some time. I wish it wasn't the way that our education system was set up in America, but that's the way that it is. I think first and foremost, utilize your local community colleges. They absolutely offer you first-rate education. Don't let anybody ever tell you any differently. VOTEC for CNA, LPN, absolutely. Those education resources are invaluable. And it's the same thing with the community college. So if you can get as much of your education done through the community college setting, absolutely do that. The tuition is going to be far less than at the university setting, and your education's not going to be any less. Trust me. I got my associate's degree from Central Florida Community College in Ocala, Florida. It's actually called something different now because a lot of the community colleges in Florida are converting into like state colleges, like SCF is now. My son is going to school in Denver, and he's going to Arapahoe Community College, and the per hour tuition rate is far, far less than the University of Colorado. So as much as you can get done, and a lot of times you don't really have a choice, right? Like I didn't go to school full time to get my graduate degree because I had to work. So, taking fewer classes obviously stretches the time out that you're going to be in school, but, the time is going to go by regardless. So honestly, moving forward and, taking maybe a few classes a semester instead of a full load while you're working to help pay for that as well. There are always ways to get student loans and such. It's not really wouldn't be my preference, but for some people it's what has to happen. So yeah, I wish I had better advice about that, but definitely utilizing your vocational schools and your community colleges. Absolutely.
That is great advice. And also due to the, unfortunately, the critical shortage of nursing professionals,
Mhm.
there are plenty of opportunities to get scholarships and grants out there. So
Yep,
because they need nurses so desperately.
right.
So students that are listening, you can go to the local community foundations. They have scholarships that are available. The technical colleges have some assistance to help you get into school, to pay for your school. There are, local grants, state grants, federal grants, and then of course that four-letter word, loan. And I'm glad that Amy brought it up, and I've heard other professionals say that, it's not the end of the world if you end up having to take out a loan, because you, as a health professional, you will be able to find a job and you will be making good money that can pay those loans off.
Right.
So never fear about that. The money will work itself out, that there are scholarships,
Well,
grants, and loans.
right.
Absolutely.
And hopefully, there's, some pre-planning, in place, like the Florida prepaid college program, offers an excellent, you know, avenue for people to have their tuition saved for and paid for, or their education. Also too, bright futures in Florida. So I know that the standards keep getting tougher and tougher, but if you can, really get any level of bright futures, that's going to help so much. And obviously it has to do with your grades, your SAT scores, different things like that. So, certainly do everything that you can to take advantage of those plans, those programs.
Absolutely. Students, you should start talking with your counselors as soon as
Yeah,
you hit those ninth grade doors
yeah,
when you walk through there, to help make your plan of what you want to do and how you can accomplish that. And they
for
can help
sure.
you find
Yep,
those scholarships, grants, and loans. Now,
exactly.
Amy, walk us through your job at SMH. What's a typical day like, or is there such a thing as a typical day?
It varies from day to day, depending on the day of the week. So I see patients in clinic most days, 4 days out of the week. I've been doing a lot of telehealth calls because of the pandemic. So we're really moving more towards telehealth. So really my involvement, I have a lung cancer screening clinic visit that I have to do with my patients before they get their lung cancer screening. And that just basically helps them understand the risks and the benefits of lung cancer screening. So you think, oh, well, what could the risk possibly be? But, there are actually some things that we need to discuss so that patients can understand and make an educated decision about moving forward with their screening exam. I also provide smoking cessation counseling. So everybody that comes in that's currently smoking, they either get, they get the counseling, or if they're not smoking, relapse prevention, because we know that with tobacco, relapse is really common. So, I see patients throughout the day during my clinic hours, usually at a screening location. So wherever the CAT scan machine is. And so we have 4 different locations where we do screenings. And then on the days that I'm not, I'm doing other administrative type tasks or other sort of, responsibilities related to promoting tobacco control in my healthcare system, or working on, incidentally found pulmonary nodules. That's a whole nother sort of aspect of my job as well, that has to do with the early detection of lung cancer as well. So there are a lot of different things, and that's more of like behind the scenes, just in front of a computer, working with a software program, and notifying physicians and patients, and really sending a lot of letters out and phone calls and things like that related to those findings. So it really varies. On Tuesdays we have tumor board from 12:30 to 1:30. So I know I'm always kind of here in front of my computer, ready to sort of discuss my cases. And then other meetings and things like that throughout the week. So it's very there's a good very yeah that's I mean my favorite part of my job is when I get to sit down with a patient and talk about the early detection and prevention of lung cancer. That's when I feel most valuable.
Now, are you just working days? Is it a 40-hour week? Do you have to do weekends?
No, I work Monday through Friday, 8 to 5 or 9 to 6, just sort of, fortunately, as a nurse practitioner, you don't necessarily have a clock in, clock out kind of a time, in my position anyhow. So that actually is nice. I do work part-time for or per diem as needed for the local hospice. And I work about one weekend a month, and I do hospice and palliative care in their inpatient units about once a month. So it gives me the ability to kind of continue with that hospice part because it's something that I will always love. And also to the opportunity to earn a little extra money.
Sure, and I'm glad you brought up money because that's a good segue because students always want to know.
I know.
To be a nurse practitioner, what's your salary range look like?
It depends on where you live in the country too, right? It depends on your years of experience, and it depends on, sort of different things. The organization that you work for, there are a lot of variables, but I think that, throughout the country, probably average beginning is between $90,000 and $100,000, depending on where you work. But, as you spend time working and you gain experience, certainly that's just going to go up from there. And that's why people will ask me a lot of times if they're graduating from nurse practitioner school, what should I ask for a salary? And what I always say to them is that don't be so hung up on, what you're initially going to be getting paid or what you should ask for. I mean, obviously you want to get paid what you're worth, but understand that as the years go on and you prove your worth and that you prove that you're making a difference, your salary is going to go up. So, you may start as a nurse practitioner making $90,000 a year, but just know that within a matter of 5 or 6 years, you're probably going to be making more like 115, between 110 and 115. So, it really varies. And it varies where you live. I mean, nurse practitioners in California probably make a way more. New York City, they probably make way more. But also, too, the cost of living is ridiculous in those places. So you can't buy a house or rent an apartment for, anything reasonable. I mean, I know prices are getting kind of crazy in Florida too, but yeah, I think that, yeah, it can vary a lot.
And it's important for students to know that they call it a starting salary for a reason because,
exactly.
because you're just
Exactly.
starting out. So you can't, go in and, hey, I'm fresh out of school. What are
Right.
you going to pay me?
Right.
You have to prove your worth first, and
Yeah.
then the money will come.
Right.
Absolutely.
Yeah. Yeah. And then the more experience that you gain, the more that's going to be put on your CV, so just keep that in mind.
Absolutely. Now, you and I were talking a little bit before we started recording today, and that you have additional responsibilities, due to the pandemic or how it's changed nursing as a whole. Can you share with us how the profession of nursing and specifically your career has changed in response to this pandemic?
Well, specifically for me in my role, what has happened is, and this is sort of a sad outcome that a lot of people don't realize, that a lot of people are going to be putting off their screening visits because they don't want to walk into a healthcare setting and potentially be exposed to COVID. So we're not just talking about lung cancer screening, we're talking about colon cancer screening, breast cancer screening, skin cancer screening. So a lot of people, generally speaking, and the American Cancer Society has actually, verified this, is so many people have just put off, these healthcare visits that are not urgent, right? As cancer screening test isn't an urgent thing. So people just think, well, I'm just going to put it off and put it off and put it off. So what's happening is, unfortunately, sadly, a lot of people are coming back diagnosed with cancers that are later stage than if they had been screened at the appropriate time. So that's one really unfortunate situation that we're seeing with cancer screening in general. So we really want to urge people, get your cancer screening tests. You can walk into a healthcare facility fully masked. Most of the people there are fully vaccinated, and you can safely get your screening. And trust me, you're more safe walking into a healthcare facility like Sarasota Memorial than you are walking into Publix. So, so get your cancer screening tests. Very, very important that you stay on top of that. And, there are specific age and gender specific cancer screening tests. Whenever somebody comes in for a lung cancer screening, I try to talk to them about all their cancer screening tests to make sure that they're up to date with everything. So yeah, that was the main thing for me. And a lot of the face-to-face visits went to telehealth or just a phone call. And so that I think really has impaired my ability to deliver tobacco treatment. It's sure it can be effective over the phone, but I prefer the face-to-face communication when it comes to those conversations. But you do the best that you can, right? Fortunately, I haven't been affected with COVID, the pandemic, as much as some of my colleagues. I mean, I have colleagues that work in intensive care. I have colleagues that work in hospice. I have colleagues that work in palliative care, and they are drowning. And it's just really been tragic to see what's happened, especially with this Delta variant wave coming through, and the people that are dying every single day. It's just been, and that does impact you over time, especially when you know that a lot of this is really preventable. And it just has been really, really, really hard for a lot of my colleagues that are day in and day out are, taking care of people in the intensive care unit and seeing people die. So, so fortunately, I haven't been impacted as much as they have, but nonetheless, we're all sort of feeling the effects and suffering from the pandemic.
With health professionals, having to put in more hours, also seeing more pain and suffering and death, it's important to note that your physical well-being is just as important as the mental well-being.
Right. Yeah.
How do health professionals make it through mentally, to become mentally sound, to make it through the disaster that they're seeing occur around them?
Well, right now I can tell you that a lot of people are not, they're suffering. It's just been really hard. Thankfully here at Sarasota Memorial, we get sort of announcements and emails, twice a week or so that really reinforce the support services that we have. So they actually have added additional support services, crisis teams, behavioralists that can help come in and help staff cope with what's been going on. We have EAP, things like that. So this hospital has been very good at helping support the colleagues through this situation. And I don't know if, we're a big healthcare system. And so for somebody who maybe isn't as big, maybe there's not the same amount of resources. So yeah, it's been really, really hard. And, everything that I'm reading is really kind of talking about how the nursing shortage that's already with us is going to be much, much worse, because people are just going to be leaving the profession because they're so burnt out.
Right. And that's important to know that there are counseling services that are available.
Yeah.
Counseling is important because you do need to talk it out, whether it be with a trained professional or some your colleagues with
Right.
fellow health professionals, and that there is extra stress being heaped upon our health professionals now, and it's something that we should recognize.
Yeah.
And it's just when we hope that we're going to be finally seeing the light at the end of the tunnel, and we have these variants come through, we've got to do a better job with taking care of ourselves mentally and physically.
Yeah.
And being surrounded by that, and talking about the doom and gloom, if you will. Let's finish this interview out with your best piece of advice for students who would be interested in this career.
Let me see, my best piece of advice. Well, I think I'd go back to what I had said earlier, I think that, a couple of things, I had talked about how earlier, if I could have taken the path of becoming a CNA first and like understanding a little bit more about nursing, but also too, in that same sort of token, I think that I would have, and this probably would answer a couple or would help with a couple of things. I look back at it and, I came, my family of origin was not able to help me pay for school at all. So it was a real challenge. And how are you going to go to nursing school when, you have to figure it out on your own? And, I did, it was sort of like this journey, right? It took me a long time. But I think one of the things that I probably would have done differently now, especially knowing and seeing a lot of, some of my colleagues that have had, got, really good educations, by entering military service. You know, I have several friends that my neighbor is a PA and she was in the Army and she was able to get her education covered, paid for through that. I have the surgeon that I work with, the thoracic surgeon. You know, he was in the Air Force and that's how he was able to get his, you know, medical education. So I think that avenue, I know it's not for everybody, but if I could go back and do it over again, I would have out of high school joined the military with the intent to seek a, you know, a profession in healthcare, likely nursing. Although sometimes I say maybe I would have gone to medical school if I had had that opportunity. But I love being a nurse. I think that being a nurse and the philosophy of nursing is way different than the philosophy of medicine, right? Nursing is focused more on, you know, holistic and prevention and, you know, healthy living and things like that. Whereas medicine's more how do you fix people once they're already sick. So I would have done that. I would have absolutely, you know, looked at becoming a CNA first, you know, working a little bit in that field to understand like, what does this field like? And is it something that I really want to pursue? I mean, I'm glad that I did regardless, but I think it would have given me a whole bunch more insight. And a way to help pay for school, because once you're working for a healthcare organization, oftentimes they have tuition reimbursement programs. And although it may not be a lot, it may pay for a semester, you know, a year or something like that. So I certainly took advantage of tuition reimbursement when I was getting my master's degree, and my undergraduate degree as well. So that's another avenue is, you know, work for an organization when you're hired full time, make sure you understand what the benefits are and if they have a tuition reimbursement program. So that's, you know, that's probably one of the biggest pieces of advice is get it done sooner while you know, before you have kids and, you know, a mortgage and stuff like that. Like try to get it done earlier rather than later. Those are my two biggest pieces of advice.
Thank you, Amy. And that's excellent advice because, again, it just reiterates that there's many different paths you can take through your education to get into the nursing field. And then there's many different paths to pay for it. Yeah. And then there's many different specialties within nursing. I think my last count, there was over 106 different specialties within nursing. So students, get out there, do your exploring, talk to your career counselors, do some job shadowing, and that will help all the pieces fall into place. So Amy, I'd like to thank you so much for giving us your time, your expertise, your knowledge. We sure do appreciate hearing from you. I'm Joan Dixon, Director of Student Programs at Gulf Coast South AHEC, and you can see our website in the back there, www.gsahec.org. We have a contact form on our website, so if you have any questions for Amy Miller, shoot us one of those contact forms and we will get in touch with Amy and she can get back in touch with you. So thank you again, and everybody have a great day.